This is a very important introduction that we have made to the ANBAI Annual Teachers' Day ceremony. It is fitting that we have an annual oration in the organization because we have so many teachers who are being recognized on this special day, and so much of work that is happening in academics around the country. So I now ask that the video first be played, and after that, the oration. May I request Dr. Harvinder Chabra to introduce the orator for this year, Dr. S. Rajasekaran.
Thank you, Dr. Venkatesh. In fact, it is my proud privilege to be able to introduce an internationally renowned stalwart who is not only my mentor, the mentor to a large number of orthopedic and spine surgeons in the country, but also to spine surgeons and orthopedic surgeons across the globe. Dr. Rajasekaran has had a very distinguished career. In addition to doing MS, Dept, DNB, F.R.C.S, and M.Ch, he has a lot of achievements and a lot of feathers to his cap. He is the Chairman, Department of Orthopaedics, Trauma and Spine Surgery, Ganga Hospital, Coimbatore, the largest specialty hospital for orthopedics, accident, hand and microsurgery, with 650 beds and 35 operation theaters. Currently, he is the chair of the AOSpine International Board and the president-elect of Asia-Pacific Spine Society. And if I were to read all his past positions, it would take the whole time of the oration. But he has been the chair, AOSpine International Research Commission, President CCOT, President Cervical Spine Research Society, Asia-Pacific, Indian Orthopaedic Association, Association of Spine Surgeons of India, International Society for the Study of Lumbar Spine, World Orthopedic Concern, and has been the Chief National Delegate of Asia-Pacific Orthopedic Association. He has various academic distinctions, amongst which are Hunterian Professor for the year 2011-12 by the Royal College of Surgeons of England, Distinguished Visitor to Harvard Medical International, Boston, Grand Rounds Lecturer of Dartmouth University and Mayo Hospital, Adjunct Professor of Orthopedic Surgery, Tamil Nadu, Dr. M.G.R. Medical University, past member of Faculty of Medicine, Annamalai University, and past member of the Planning Board, Bharathiar University, and current member of the Board of Studies of the same university, and member of Specialist Board in Spine Surgery, of course, of the National Board of Examinations. He is the Distinguished International Visiting Professorship of Dartmouth University, Chinese University of Hong Kong, Hokkaido University, Harvard Medical International. He is the Deputy Editor of the Bone and Joint Surgery, Journal of Spine, Global Spine Surgeon, Spine, Journal of Craniovertebral Surgery, all very distinguished journals per se, and has been the past deputy editor of European Spine Journal. He has had a lot of awards, research awards, amongst which have been the North American Spine Society Outstanding Research Award consecutively for 2019 and 2020, Asia Pacific Spine Society Best Clinical Research Award for 2019, Basic Science Research Award for 2019, Asia Pacific Spine Journal Award for the best clinical paper for 2019 and best basic science paper for the same year. Issel's Prize, Spine Research for the year 2017, 13, 2010, 2004. Eurospine Open Paper Award for 2008. McNabb La Rocca Research Award of Issel's in 2005. And Sofamer Danek Award for the best scientific presentation internationally by Issel's 1996, 2002, and 2006. He has won various national awards: Hariom Ashram Alembic Research Award, Dr. B.C. Roy Silver Jubilee Research Award, Hariom Ashram Alembic Research Award again, the Tri-Decennial Award for Teachers for 2012 by the National Board of Examinations, Scroll of Honor by the Tamil Nadu Dr. M.G.R. Medical University, Scientist Award for 2000, Vocational Excellence Award for 2000, and Research and Publications Award of Association of Spine Surgeons of India every year since 2003. He has 286 publications in international journals, 67 national publications, and 461 international and 530 national presentations, 64 chapters in international books, chief editor of a video atlas of spine surgery, and the ASSI textbook on spinal infections and trauma. Friends, and most importantly, he is the president-elect of Association of National Board Accredited Institutions. I could go on and on, but we have to have the oration as well. So over to Dr. S. Rajasekaran for the ANBAI oration.
Thank you, Chabra, for this very extensive introduction. You almost made me a little nervous hearing it. But I would like to start off by thanking all of you, our President, Dr. Alex, Vice President, Dr. Chabra, Secretary, Dr. Venkatesh, for giving me this opportunity. I think it's a great privilege and pride. And I would like to first express my warm regards to Devi Shetty, a mentor to all of us, and our President, Dr. Abhijit Seth, and Dr. Pavinder Lal. There is a saying in English which says, when the going gets tough, the tough gets going. And the National Board has actually proved it very well. And it looked at the tremendous strides they have made during this period of COVID is an example to the whole world what determined minds can do at times of even great hardship. Now, when Alex asked me to choose a topic, we discussed, and I thought I would start with a provocative topic because there's a lot of advance in medicine all the time. And we all need to ask the question for whose benefit they are, because young minds and young surgeons must learn to look at things very objectively. I have no financial disclosures, but more importantly, I would like to declare here, I'm not a person who is against advances in medicine, but I just wanted to make sure that it is purposeful for the president, for the patients. Now, this is a sign which all of us know, and this is called the caduceus symbol. This is internationally for medicine, but many of us may not know the reason why it is so. Now, the herald's wand as a symbol, it makes it clear that whoever chooses medicine must have prudence built into his mind. And we have to be in service of the sick. And therefore, we have to be wise as the serpents, but very important that we are also harmless as the doves. Now, in those periods, it was not a big problem. And we all took also the Hippocrates oath that I will use all my power to help the sick to the best of my ability and judgment. And more importantly, we also took the oath, I will abstain from harming or wronging any man by it. Now, the father of modern surgery, William Mayo, also said the best interest of the patient is the only interest to be considered. Now, all that is good, and this was not a problem in medicine in olden times. Even 5 decades ago, this was not a problem, because it was just the doctor and the patient and his family. There was no other stakeholder and no other middleman, and so things were very easy. But now for all us, we being what we call ourselves as modern surgeons, we are completely surrounded by gadgets, by technology, by industry, and we take pride in calling ourselves as high-tech modern personalities. But in the bargain, we are losing something. Now, before there was only the doctor and the patient, but now for many of us, we have the hospital which controls the doctors. There is the industry, then there is this insurance, and then there is the government. And sometimes, somewhere in this whole mathematics, the patient becomes small. And in fact, the doctor also sometimes becomes small. And then it becomes the industry and then the insurance. And once you do that, sometimes we have to be careful that the patient's interest is not lost. Now, while I was preparing this in the last few days, I just came across this patient who from a very big city in India. He is a person, IT personnel, 34 years old, and has just paresthesia in his upper limbs. And he was operated by a very controversial 3-level cervical disc replacement, which is totally against all principles. And this led to him getting worse. And he was done again by laminectomy on the posterior side. And they put multiple other strands. And this patient, who was completely walking well, had to spend 3 years in a wheelchair. And when we saw him. So is this advance in medicine? Is it a love for technology? Or what happens? Why we adopt these? So younger surgeons have to know that every advance or anything that comes as a current concept is not an advance till it is proved over 3 or 4 years that it is really good and it does not have a bad effect. Now, why is this important? Now, if you look at the orthopedic device alone, and this is just one specialty in medicine, it is so huge. And in 2017, it crossed the prediction of $61.3 billion. And interestingly, this is more than the GDP of 25% of the nations in the world. And 70% of them are occupied by recent advances. But if you actually look at the industry's contribution, innovations with potential for contribution, very important impact to existing therapies is only 3%. This is very surprising. And 13% contribute with a moderate potential to improve existing therapies. And 84% have little or no potential to contribution to existing therapies. Now, this is a slide I took from Max Eby, and this is a fantastic slide. So whenever there is a first improvement or innovation comes, it has a small cost and a great benefit. For example, if we take the pedicle screw in spine surgery, the first pedicle screw was a great benefit and less cost. But when you come over to the 30th modification, 55th modification, and the 100th modification to the same screw, there is a huge increase in cost, but the benefit becomes smaller and smaller. Now, innovations and advance flops cost a lot of time and money. And 9 out of 10 products, innovations fail in a few years. Some also cause harm. And so we have to be really careful. Now look at this graph. Healthcare spending has grown much faster than the rest of the economy in the decades. Now the rest of the gross domestic product, GDP, is over here. Wages are increasing very lowly. But the medical cost has increased 818%. What causes it? It is actually the cost of recent advances. Now you may ask, should we suppress science? Should we express advances? I'm only against the fact that we would allow the usage of recent advances on our patients before they are actually brought into and tested very well. If aviation industry works with the same level of safety and they introduce everything before it is tested, only one thing will happen. There will be no frequent flyer in this world. I mean, nobody could have survived this. So new advances and new techniques, why does the medical family hurry into adopting it? And we need to remember the Scott's parabola. Now, just as we have a natural history for a disease, Scott, who is an obstetrician, actually published this in the British Medical Journal in 2001 as the natural history of every medical device. It always comes as a promising idea, and then there is a lot of enthusiasm, there is the implementation, it is published, it is discussed in the media, people think of it, lots and lots of people use it, then there is problems reported, then rejected by experts, then not used anymore, and then is equipment still needed, and it gets. Now, 85% of any advance in medicine gets it. We as doctors, as young surgeons, we need to be careful that we don't fall a problem into this upswing before there is a problem. Because that curve is the golden curve of profit for the industry. And before it starts sliding, these 85% of advances are already reaching the market because they are promoted in sponsored workshops, instructional courses which are held in resorts, lunch symposia, inclusion in clinical trials, and whopping consultant fees for the first few surgeons who use it. So this is something that we need to be careful. And me as a spine surgeon, I would like to tell as an example of what we are doing to the disc. In fact, there is nothing that we have not done to the degenerating disc. We have actually irradiated it, we have injected enzymes into it, we have done magnetotherapy, we have burnt it by putting IDET, we have put enzymes chymopepine, we have sucked it out, put nucleoplasty. And if you see in the last few years, there is 21 types of newer intervention for disc degeneration, but outcomes often have been no better than conservative treatment, but each of them have considerably exploded the cost of this treatment. It is not the size of the wound, but if it is not indicated, it is still the unkindest cut of all when we do this for a patient. So what makes an innovation click? We always talk of it as an evidence-based medicine, but we need to know that even what is published in medical literature, young surgeons must learn to take it correctly, see from whom it is coming from, who is the author, which organization, is it funded? Because look at this, how many scientists fabricate and falsify research? Now, they took up organizations which are really worldwide famous for research, and 5% of the researchers agreed to have committed false results. 17% said they knew of colleagues who had committed questionable research practice, and 39% patients said, these researchers said they know of cases of bias or fraud. So if you look at it, approximately 40% of research are coming under question, because many of these published material are coming from the industry, but speaking through the voice of these surgeons, because the rate of ghost authorship in excellent journals, highly indexed journals like New England Journal of Medicine, is that ghost authorship is up to 16%. Now we need to be careful about this, because in these very famous trials, the Merck's roficoxib trials and in Scott Rubin's Pfizer trials, they actually found that Scott Rubin had produced 18 papers that were published in high impact journals. But there were only one problem with the study, that no patients were ever enrolled. It was all cooked up in his, and all these 18 papers were retracted. And they also found in these 3 pharma trials of the Celebrex study, Bextra study, and Vioxx study, which gave billions of dollars of sales before these came out. Each of the authors had been paid $420,000 as consultant fees. So we really need to be careful that whenever we are looking at any of these breakthrough studies which come, we need to be careful on who are the authors, who has funded the study, and what is the purpose of this study. Now, Chabra will know that the Association of Spine Surgeons of India has been fighting tooth and nail against the stem cell therapy. I mean, there is a lot of marketing in the name of stem cells, which can make people walk immediately after a spinal cord injury. And these have been used for now everything. Parkinson's disease, cardiomyopathy, avascular necrosis, all kinds of myopathies. The whole medical field knows that it is not possible, but still there are many, many, many different areas where you see. And that is the reason why there is a small erosion of the doctor-patient relationship. And if people have not read it, I would encourage all the young doctors to read this book by Kenny, When Healing Becomes a Crime. Because once you read the book, forever, throughout our professional life, we would all be looking very good. So Relman, as in his article in the New England Journal of Medicine in 2009, Doctors as the Key to Healthcare Reform, he said, from unquestioned God to accountable workers is a long way to fall in a few short years. Now, we all say that, unfortunately, we are falling down. The society is not looking up to us. And we have to stay at a real good height in our professional life so that the society will look up to us. So what is the solution? Now, as Gandhiji excellently said, if we are not a part of the solution, then we are all the part of the problem. And what we need to do for at least a part of our professional life is to take a break from new technology and focus on affordable healthcare. I am so inspired. My brother and I actually are so inspired by Aravind Eye Hospital that we always, whenever we have a problem, we look up to Aravind Hospital and look at what are the solutions they had and steal their ideas. And I'm so grateful that Professor Nambaramal Sami accepted to be taking one of these prestigious trophies from us. Now, they were able to show that 302,000 surgeries they do every year. When I presented this statistics in one of the international conferences, at the tea time, the president of the organization came and told me, I think there is a problem in one of your slides. I think you have added a 0 by mistake. I said, no, it is actually true that it is 302,000 surgeries. Now, their research was not to build their coffers or for profit. Their research and advances were for catering for the needs of the society. And they patented it not for profit, but to serve the world. And we have our pattern, Devi Shetty, from whom we know that open heart surgery can be done for as less as $1,000. Now, on this basis, actually, when we built the Ganga Hospital, we didn't take pride of doing large number of surgeries, but we took this as a cue from these two organizations and built devices by which replantation can be done for 1 lakh, scoliosis surgery can be done for 1 lakh, and even major reconstructions can be done for 1.5 lakh. So while a part of our professional life must be on research and on doing on cutting edge surgeries and very complicated surgeries, a big ratio of our professional work must be on how to give back to our societies. So it is true that most of us in this part, that we are as the physicians, we are very wise as the serpents, but we now have to be sure that we are entirely as harmless as the dove for our patients, and we will do good for it. So to end, I would like to tell this, which I really enjoyed when I read this story. In the olden China, a family doctor was paid only when his patients stayed well. Now, he got a monthly fee, when there was no illness in the family. Any month, any one of the family members became sick, he was not paid. So the doctors in China were very careful on preventive medicine. They were doctors of wellness. They were not doctors of sickness. Because to maintain his patients and his patient's family free of disease was what made him happy and wealthy. If his patients became sick, he also became poor. So I think we have to become this, and we medical men have to become apostles of wellness and not curers of just sickness. So China doctors in olden age was interested in the lifestyle, nutrition, family issues, home environment, etc. because he was actually more a health teacher. Sickness made the doctor a pauper, but opposite is happening in modern world. Sickness of patients make the doctors more wealthier. So we need to change this, and we need to really care about that. A true advances medicine is only what actually is of benefit to the patient, not to the insurance, not to the industry, not to the hospital, or not to even to the doctor, but a true advance is only what is an advance and benefit to the patient. So let me thank our President Alex, our Vice President Chabra, Secretary Dr. Venkatesh, and all the members of the executive of ANBAI for giving me this great honor for this. Thank you very much.